Yeah, absolutely. So look, for this, we just kind of need to go back to the basic anatomy, just because it makes more sense and we understand what's actually going on inside the eye. So, see if I can point at the screen. There's our little eye model. I'm trying to hold bits so it doesn't all fall out in my lap. But front of the eye, lens and cornea up front, and this is the vitreous cavity, so the back part of the eye that's usually filled with gel. So the gel in the back of the eye is actually collagen, which is the substance that's in all of our connective tissue. But in most of our connective tissues, they're very, very high in collagen content, not much else. Whereas the vitreous is relatively low collagen content and lots of water. So it's got the consistency of jelly, but it's actually a form of connective tissue. That vitreous has important roles in the development of the eye. So when a fetus is developing, the gel has a role in supporting blood vessels that are going to nourish the developing structures inside the eye. But once the eye is developed, that gel doesn't really have very much of a role anymore. It does a few things in terms of, we think it's got some roles in assisting with oxygen diffusion into tissues and some other bits and pieces, but nothing that you can't do without. And we know that because when we do a lot of retina surgery, the first step is removing the gel from inside the eye because we can't work on the retina when it's still there. And we know that when you do that, it doesn't have any serious long-term impacts on the eye. So really, it's a tissue that has a role in development of the eye, but doesn't do much for the rest of your life other than just be there and potentially cause problems. So that gel, when you're younger, is fairly well formed. It's a discrete gel-like substance, but over the course of your life, it gets more and more watery over time. And eventually, it gets so watery that it starts to separate away from the retina at the back of the eye. And in normal development, what should happen is that gel should just very gently peel away from the retina and float harmlessly within the eye without anyone noticing that it's ever happened. A small number of people will have the gel tear a little bit as it comes away and throw up debris into the space inside the eye, which is what we see as floaters, just little black or specks or little wiggly worms and things in the vision. Some people see them as clear things or grey things or black specks. That's all a little bit different. And it can also cause flashes of light, whereas it's separating away and tugging on the retina a little bit. It irritates the nerve fibres and you perceive that as a flash of light. The reason we worry about these things is because those symptoms are exactly the same as the symptoms of a retinal tear and potentially a retinal detachment. So even though posterior vitreous detachment is normal and happens to everyone at some point in the course of their life, it can cause problems. And we want to identify the people who may have those problems. So there's no way for an individual to tell whether the flashes and floaters they're seeing are just normal from the posterior vitreous detachment or whether there's a tear there. So if we get those symptoms, we want you to come along and either to us or to an optometrist or someone who can have a look in the back of the eye and just confirm that all it is the gel coming away and not something more serious.
Okay. So you likened it to cataracts as something that, most of us are going to naturally experience. In the case of cataracts, though, like eye care professionals will sort of give you advice on the things that you can do to prevent them or slow it down. Do you give advice to patients on PVD in a similar way? Or is it something that can be or should be prevented, or is it just something that's it's going to happen?
Cataracts, yeah, that's a good question. I mean, cataracts. The reason we try to slow down or prevent cataracts is because of the fact that they need something done about them. So, once you get enough cataract, it does actually start to affect your vision. Whereas posterior vitreous detachment, yes, it's the highest risk period for developing a tear in the retina, but we know that most people don't, and it doesn't have any long-term impact on vision unless you get some floaters with it. And really, it's not something that we look at as needing to be prevented, though ideally we want to make sure that it happens in a controlled way rather than suddenly, and that's why we say, we try to avoid eye trauma. So, getting punched in the eye or hit in the eye is really not good for you for lots of reasons. And one of them can be that it can trigger an early posterior vitreous detachment that could be forceful enough to cause a tear in the retina. And so things like bungee jumping and that sort of thing can do the same thing. I'm not going to go out there and tell people not to do these things because we know that plenty of people do them and don't have retinal tears or detachments, but particularly for patients who are already at high risk of those conditions. So someone who's, had previous eye injuries, or someone who's very, very short-sighted and we know is at high risk of retinal detachment, or someone who's got a big, strong family history of it, they're the patients that I'm going to be saying, look, bungee jumping might not be for you. There's lots of other fun adrenaline sports you can do, but maybe don't do that one.
Okay. Right. So if I'm hearing it correctly, so you're saying that for people who have a high risk of retinal detachment, for example, then they need to be a little extra cautious.
Yeah, exactly. And it's just because, like I said, we know that the gel coming away from the back of the eye is a time when all of us are at increased risk of developing a tear in the retina because things are changing. And so anything that can force that process to happen earlier than it was going to, or with a bit more force than it was going to, can be risky for people who are already at increased risk of tears and detachments.